you might well ask, why is preceptorship important? You could say to me, couldn't you, well look, Bob, it's a situation where we didn't have to have preceptorship. When I trained, we simply went into practice. But remember, I think the situation is different. The situation is different today because of the volume of information that students are needing to learn. Qualified nurses have to deal with technology, they have to deal with different age groups, they have to deal with much more complex medical conditions and in short stay hospital admissions. So life is much more difficult for a newly qualified nurse. So preceptorship's that important building block between competence, where they've qualified, and confidence, where they are able to articulate all the new things that they are going to do, using their skills, but continuing on to learn about the groups of patients that they will care for. Now, the first important adjustment between coursework and preceptorship is that, of course, when students are learning coursework, they are assessed. It's about competence. When they come to learning associated with preceptorship, they are going to be developing and enhancing their skills. They're going to be moving on without formal assessment. And that's an important transition for them. It's about working with their needs as much as working with standards and priorities of practice. It's enabling them to gain the confidence and gain the drive which is necessary for them to go on learning. There's nothing more important, because if they're going to work for 40 plus years within the healthcare professions, then it's important that they begin in a confident manner. It's important that they feel that they can go on inquiring, and that's done through successful preceptorship. I think the second important adjustment associated with preceptorship is, of course, they're having to engage in real-time thinking. They're going to have to think faster. They're going to have to think in articulate ways and with particular groups of patients that they have not met before. Whereas in their initial placements, they work with lots of different groups and with a little bit of knowledge. Now, in their clinical practice, they're going to work with a given clientele that you know a lot about. And they're going to have to think very quick and very fast about that. They're going to have to think on their feet. We sometimes call this nous. Northern people know what I mean by the term nous, but nous means a local, adaptable, flexible, just in time, just right knowledge. It's wisdom. And what you're going to share with them through your experience of working with those particular clientele is going to enable you to help them to think in more articulate, flexible, real-time ways. Now, the third important adjustment associated with preceptorship is to do with skills. You may be surprised about this, but in fact, students, once they've qualified, still have some skill refinement to do. They may be competent, they may know how to communicate, they may know how to make judgments, they may know how to measure things, they may understand the principles and the practice of risk. But it's another matter to say that they're confident in all aspects of their skill. It's the case that in placements and their course, there may be little nuances, little details about the practice of a skill that they've not checked out as much as they wanted to. The key gift that you can give them as a preceptor is to give them a chance to rehearse those skills with you and in circumstances that you know so well. You know the local practice, you know the local patients, you know the local policies and the protocols. This is about building confidence within the local circumstances that prevail. Now, why has this module come about? It's come about for a number of reasons. The first is certainly a sense of frustration. I've often worked with trusts and organisations where they have confused induction with preceptorship. Nurses who are newly qualified and moving into a new post most certainly need to know about their role. They need to know about the local policies and the protocols. They need to know about the communication systems and the record systems of the trust. But they also continue to need to develop their skills, and they need to build their confidence as newly qualified practitioners. And that can only be provided by a preceptor who knows the local patients, who knows the local environment, who know the sorts of challenges and opportunities that it provides. A newly qualified nurse is not going to stop learning. A newly qualified nurse who's going to succeed over the length of his or her career is going to do so because of the quality of the listening and support and reflection and debate that a good preceptor gives to them as part of this program. They're not going to be assessed by the preceptor, they're going to receive feedback from the preceptor, and at best they're going to carry on into a career where they can enjoy their nursing and where they can continue to be imaginative, innovative and flexible people. We're going to need that in nursing. We're going to need it in the years ahead, and I think that you will benefit and you will build on your ideas about preceptorship if you complete this module.